Hello everyone, you are all welcome to Alveoly E-learning. Alveoly E-learning is a non-governmental organization that supports the learning of students across the country. This tuition is purposely for Alveoly E-learning students and anyone interested in health education only, and should not be replaced with textbook or classroom tuition. We have already done simple tutorials on the introduction to the nursing care plan, as well as how to write the patient problems in association with the patient strength in the previous videos. So kindly watch them if you haven't. In this tuition, we are going to look at series of examples of patient problems, their strength, objective outcome criteria, and formulate their nursing diagnosis plus their nursing orders. So let's have a look at 1. Patient problems at the medical ward, and mostly for very weak or unconscious patient or stroke patient who cannot do anything. Patient problem 1. Patient cannot bath. Strength: patient can be bed bathed by nurses. Possible nursing diagnosis: 1. Self-care deficit, bed bath, related to general body weakness. Or 2. Self-care deficit, bed bath, related to unconsciousness. Or 3. Self-care deficit, bed bath, related to paralysis or weakness of the limbs, stroke. Objective or outcome criteria: patient will be bed bath within 45 minutes, as evidenced by patient looking clean and neat in bed. Nursing orders: 1. Reassure patient that he or she will be bed bathed. 2. Perform bed bath. 3. Change soiled linen from side to side. 4. Treat pressure areas. 5. Groom patient and make patient comfortable in bed. So from the orders you are likely to get: 1. Bed bath as your task. Or 2. Changing of soiled linen from side to side as your task. Or 3. Treatment of pressure areas as your task. Or 4. Making of simple occupied bed as your task. 2. Patient with nasogastric tube. With such patient they are mostly at the medical ward. Note: please be very observant. Most nasogastric tube at surgical are mostly for drainage. So always check if the tube is connected to a bag for drainage when at the surgical unit. Hence with nasogastric tube for feeding. Patient problem 1. Patient cannot feed. Strength: patient has nasogastric tube in placement or in situ for feeding. Possible nursing diagnosis: 1. Self-care deficit, nasogastric tube feeding, related to unconsciousness, that is if patient is unconscious. Or 2. Self-care deficit, nasogastric tube feeding, related to difficulty in swallowing, if patient is conscious, but on NG tube. Objective outcome criteria: patient will be fed through nasogastric tube within 45 minutes, as evidenced by feeding successfully through nasogastric tube without any complication. Orders: 1. Reassure patient that he or she will be tube fed. 2. Make patient comfortable in a simple occupied bed in a high Fowler's position. 3. Perform oral care. 4. Perform tube feeding. 5. Record amount of liquid diet in the fluid intake and output chat. 6. Make patient comfortable in bed. 7. Documents in fluid intake and output and balance after 24 hours. So from the orders you are likely to get: 1. Simple occupied bed as your task. Or 2. Mouth or oral care as your task. Or 3. Nasogastric tube feeding as your task. Or 4. Fluid intake and output as your task. 3. Now let's look at assisting or supporting patient for oral or spoon feeding. Patient problem. 1. Patient cannot feed without assistant. Possible strength. 1. Patient has appetite for food. 2. Patient can swallow. Possible nursing diagnosis. 1. Self-care deficit. Spoon feeding, related to general body weakness. Objective outcome criteria. Patient will be spoon-fed within 45 minutes, as evidenced by patient taking 75% of food served. Nursing orders. 1. Reassure patient that he or she will be spoon-fed. 2. Make patient comfortable in a simple occupied bed in a high Fowler's position. 3. Perform oral care. 4. Spoon-fed patient. 5. Congratulate patient and document. So from the nursing orders you are likely to get: 1. Simple occupied bed as your task. Or 2. Mouth or oral care as your task. Or 3. Spoon feeding as your task. 4. Now let's have a look at a patient with urethral catheter, and you want to do catheter care. Patient problem. Patient can develop urinary tract infection. Possible strength. 1. Patient catheter is dripping well. 2. Patient is not presenting signs of urinary tract infection. 3. Patient has normal body temperature. 4. Patient can take in a lot of oral fluids. Nursing diagnosis. Risk for urinary tract infection related to indwelling urethral catheter. Objective or outcome criteria. Catheter care will be done within 45 minutes, as evidenced by catheter looking clean and dripping well and patient not presenting signs of urinary tract infection. Nursing orders. 1. Reassure patient that catheter care will be done successfully. 2. Check vital signs. 3. Perform catheter care. 4. Document urine output in the fluid intake and output chart. 5. Make patient comfortable in a simple occupied bed. So from the orders you are likely to get: 1. Simple occupied bed as your task. Or 2. Vital signs as your task. Or 3. Catheter care. Or 4. Fluid intake and output as your task. End of tutorials on examples on how to formulate patient problem, strength and nursing diagnosis made easy for practical exams by Alveoly E-learnin. Please watch the subsequent videos for more examples on various patient problems with their corresponding strength, diagnosis, objective outcome criteria, and nursing orders. Your comments and questions are welcome. Please subscribe, like and share Alveoly E-learnin YouTube channel link. Call or contact the course instructor on +2335 4955 6116 on WhatsApp for further tuition and explanation on any health tutorials. Thank you.